or someone you know expecting a child? Perhaps you've heard of Down syndrome and are curious about what it means for your child's future. How does Down syndrome affect a person's life? What are the common challenges and joys that come with it? Stay tuned, because in this video, we're going to answer all your questions about Down syndrome and provide valuable insights into this unique journey of parenthood. So, let's dive into the world of Down syndrome together. Once upon a time, there was a woman named Jessica. She was expecting a baby, and the excitement in her family was beyond words. Everyone was eagerly looking forward to welcoming a new, healthy member into their family. As the days passed, Jessica started experiencing labor pains. The moment had arrived. In the delivery room, the anticipation was at its peak. After a lot of hard work and determination, Jessica gave birth to a beautiful baby. Her parents, who were waiting just outside the delivery room, couldn't contain their joy when they saw their grandchild for the first time. However, as they looked at the baby's tiny face, they noticed something different. The baby had some facial features that they hadn't expected. This brought a mix of emotions. Jessica and her family felt a bit confused and concerned. The doctor, a kind and reassuring figure, noticed the family's worry. She gently approached them and said, "I've observed some features in your baby that are associated with Down syndrome." The word syndrome sounded heavy, and it weighed down their hearts. Jessica and her family were worried and unsure about what this meant. They had heard about Down syndrome but didn't really understand it. The doctor noticed their concern and took a moment to explain. She said, "Down syndrome is a condition some people are born with. It's not something anyone can control or predict. It happens because your baby has an extra chromosome, which is like a tiny instruction manual for our bodies. People with Down syndrome have 3 of these tiny books, while most of us have 2. The doctor continued, "To answer Jessica's questions, Doctor, what is Down syndrome?" Down syndrome is a genetic condition where individuals are born with an extra chromosome. Most people typically have 23 pairs of chromosomes, making a total of 46. However, in the case of Down syndrome, there's an extra copy of chromosome 21, resulting in a total of 47 chromosomes. This additional chromosome affects the development of both the brain and the body. Doctor, who does Down syndrome affect? Down syndrome can affect anyone and doesn't result from anything parents do before or during pregnancy. Most cases of Down syndrome occur spontaneously. It's not usually an inherited condition, following neither an autosomal dominant nor a recessive pattern of inheritance during conception. Doctor, can you tell me, what are the risk factors for Down syndrome? Research is ongoing to understand the risk factors for Down syndrome better. It's generally observed that the risk of having a child with Down syndrome increases as the birthing parent's age advances. Individuals who are 35 or older are more likely to have a child diagnosed with Down syndrome. This is because younger individuals have higher fertility rates. How common is Down syndrome? In the United States, Down syndrome is the most common chromosome-related condition. Approximately 6,000 babies are born with Down syndrome each year, equating to around 1 in 700 births. Doctor, what are the symptoms of Down syndrome? Down syndrome manifests with physical, cognitive, and behavioral symptoms, although not all individuals with Down syndrome experience all of these symptoms or to the same degree. Physical signs of Down syndrome typically present at birth and may include a flat nose bridge, upward slanting eyes, a short neck, small ears, hands, and feet, weak muscle tone at birth, a small pinky finger that curves towards the thumb, a single crease in the palm, palmar crease, shorter than average height. As children with Down syndrome grow, they may encounter additional conditions, including ear infections, hearing problems, vision issues, dental concerns, and heart conditions. Cognitive symptoms of Down syndrome may result in intellectual or developmental challenges. Children with Down syndrome might reach developmental milestones at a different pace compared to their peers. Behavioral symptoms might also occur, often arising from communication difficulties. These behavioral signs can include stubbornness, attention challenges, and obsessive or compulsive behaviors. Doctor, what causes Down syndrome? Down syndrome arises from an extra chromosome. In most human cells, there are typically 23 pairs of chromosomes, totaling 46. However, in Down syndrome, there's a change in the way cells divide in chromosome 21, resulting in an additional chromosome. This leads to 3 types of Down syndrome: trisomy 21, the most common type, accounting for 95% of cases, where there are 3 copies of chromosome 21 in each cell. Translocation Down syndrome, in this type, chromosome 21 attaches to another chromosome partially or completely. It's seen in less than 4% of cases. Mosaic Down syndrome, the rarest form, affecting less than 1% of cases, where only some cells have the extra chromosome 21. Doctor, how is Down syndrome diagnosed before birth? Before birth, prenatal screening tests are used to assess the risk of Down syndrome. These tests do not provide a definite diagnosis but rather indicate the likelihood of the condition. Positive screening tests are followed by diagnostic tests, which do confirm a diagnosis. Diagnostic tests involve some risk for the birthing parent and the fetus and may include amniocentesis chorionic villus sampling, CVS, percutaneous umbilical blood sampling, PUBS. How is Down syndrome diagnosed after birth? After birth, healthcare providers look for physical signs of Down syndrome during a physical examination. To confirm the diagnosis, a karyotype blood test is conducted, examining a small blood sample to identify the presence of an extra chromosome 21. What if I find out that the fetus has Down syndrome? If you learn that the fetus you're carrying has Down syndrome, your providers will guide you to resources to support you after your baby is born. Consider participating in counseling or joining a support group where you can connect with other parents who have experienced similar challenges and joys in raising a child with Down syndrome. Doctor, how is Down syndrome treated? While there's no cure for Down syndrome, treatment and therapies can help individuals with the condition reach their full potential. These treatments focus on promoting physical and mental well-being. Treatment options may include physical or occupational therapy, speech therapy, participation in special education programs at school, treating any associated medical conditions, using glasses for vision problems or assisted hearing devices for hearing loss. Who is on my child's care team? A child with Down syndrome will likely have a team of specialists to ensure their overall health. This team may include primary care providers, medical specialists, such as cardiologists, endocrinologists, geneticists, and hearing and eye specialists, speech therapists, physical therapists, occupational therapists, behavioral therapists. Doctor, what other medical conditions are associated with Down syndrome? Individuals with Down syndrome may experience other medical conditions either at birth or over time. These can include heart problems, thyroid abnormalities, gastrointestinal issues, autism, and Alzheimer's disease. Notably, the risk of developing Alzheimer's disease is higher for people with Down syndrome, occurring in approximately 30% of individuals in their 50s and 50% in their 60s. How can I prevent Down syndrome? Down syndrome is a genetic condition, and it cannot be prevented. If you're concerned about the risk of having a child with a genetic condition, consult with your healthcare provider regarding genetic testing. What can I expect if I have a child diagnosed with Down syndrome? Children with Down syndrome can lead fulfilling lives with the right support. While there's no cure for Down syndrome, symptoms are manageable, and treatment can help individuals reach developmental milestones, gain an education, build relationships, and have successful careers. Support groups and resources are available for parents, family members, and caregivers. Doctor, is there a cure for Down syndrome? There is no cure for Down syndrome. It's a lifelong condition. However, with appropriate care and support, individuals with Down syndrome can thrive and lead fulfilling lives. Doctor, what is the life expectancy for people with Down syndrome? The life expectancy for individuals with Down syndrome is 60 or older, and they may require support throughout their lives. What resources are available for people living with Down syndrome and their families? Numerous resources are available to support individuals with Down syndrome and their families. Many families find valuable support in Down syndrome support groups where they can share experiences and learn how to best care for their child. These groups offer a sense of belonging and provide helpful advice and emotional support. Jessica and her family began to feel reassured. The doctor's kind words gave them hope. They understood that their baby, though a bit different, was just as precious and full of potential as any other child. The journey ahead wouldn't always be easy, but they knew they weren't alone. With the support of their family, friends, and the guidance of the medical team, they were ready to embrace this new chapter in their lives. And so, Jessica and her family embarked on a path filled with love, learning, and the beauty of diversity. They discovered that even in the face of the unexpected, the love for their child would be their guiding light. As days turned into weeks, Jessica, her family, and their new baby started to build a beautiful life together. They found support from various sources, including a local Down syndrome support group. This group connected them with other families who had gone through similar experiences. They shared stories, advice, and a sense of community that helped ease the initial anxieties. The family's medical team also played a significant role. They closely monitored the baby's health and development, providing guidance every step of the way. Jessica and her husband were determined to give their child all the love, care, and opportunities they deserved. The baby started meeting milestones, albeit at a slightly different pace compared to other children. There were moments of frustration and concern, but there were also moments of immense pride as they celebrated every small victory, the first smile, the first word, the first steps. In time, Jessica and her family began to realize something extraordinary. Their child, just like any other, was a unique individual with their own personality, dreams, and abilities. Down syndrome didn't define who they were, it was just a part of their story. The family took a journey of learning and discovery together. They advocated for their child's education and social inclusion, ensuring they had every opportunity to grow and thrive. They discovered that love, patience, and understanding were their most powerful tools. As their child grew, so did the love that enveloped their family. The initial worry and doubt transformed into a deep appreciation for the richness that diversity brought to their lives. The story of Jessica, her family, and their beautiful child with Down syndrome is a testament to the power of love, resilience, and the strength that comes from embracing life's unexpected moments. They learned that with open hearts, every child, regardless of their differences, can fill a family with boundless joy and love. This journey was just the beginning, and they looked forward to every chapter yet to be written, knowing that they would be filled with love, laughter, and the beautiful moments that make life truly extraordinary. In conclusion, we hope this video has shed light on the world of Down syndrome, giving you a better understanding of what to expect and how to navigate this incredible journey. Remember, every child, including those with Down syndrome, brings their own unique gifts and talents into the world. While there may be challenges, there are even greater joys and triumphs along the way. So, if you found this information helpful and want to stay connected with us for more insights, please consider subscribing. Together, we'll continue to support and celebrate the amazing individuals with Down syndrome and their families. Thank you for joining us on this enlightening journey.